My child life philosophy is very important to me. I really like to surround it around play, family centered care, and the emotional and developmental needs of children in the healthcare setting. I've seen firsthand how much play helps normalize the hospital and reduces those stressors and fears that those children and families have, and how it really helps make that child grow and go to the next stages of maybe their checkoff chart that they might have or their goal chart that they might have. And I just feel like um, as well as with that, family centered care is very um, important to me. I think everyone deserves to know what is happening in the hospital, and they have a choice of what they want to do, and that's a huge thing for a soon to be child specialist that I want to be, is that being an advocate is just a huge belief for me for being a child specialist, because I am their support system. I'm going to advocate for them. I'm going to help them get what they need. And I understand sometimes things will get overlooked, but as a child specialist, I don't want that to happen. Um, I also just with having those emotional and developmental needs, I really want to use my knowledge and research that I've learned these past few years to really help out children in the hospital, maybe answer questions to medical staff or families of why that child might be acting that way because of what stage of Piaget or Erickson they might be in, and how normal that might be, or maybe that might be an early indicator that maybe we should get that checked out. Um, and I just feel as a role as a child life specialist is to just be the support system for that family and that patient, and just to be someone who's positive and who will listen to that patient and family's concerns and really just help ease their stressors. I also want to be an educator for families and patients, because families and patients come into the hospital and they have no idea what's going on, and I want to be that person who can help educate them using age-appropriate language to foster around that family-centered care, making sure that they understand what I'm saying and do the teach-back method where they can tell me what I had just told them, so that way I know for sure they are prepared and ready for anything that might come. And I understand that I feel like a child specialist can't be doing everything at once, but it kind of feels like that. And just, you know, we have so many roles, it's hard to just say that our role is just a child specialist and name one thing. We have so many things on our plate, and that is what it's like to be an advocate or an educator, a person who will just listen, someone who will just get water for someone. And that's what it's going to be like. And I know not everyone in the medical staff really appreciates child life specialists, but and I know some days will be harder than others, but the people that will utilize them and advocate for myself to be utilized will make a difference in every child and patient's and family's lives.